Hello, my name is Miranda Pickett, and welcome to my lesson of splinting long bone fractures and injuries in EMS. Today's topic will focus on the proper procedure of splinting long bone fracture injuries as an EMS provider, and we'll discuss the indications, the proper steps to splinting, and we'll also discuss some important reminders regarding the splinting. So from this lesson, our lesson objectives are that by the end of this lesson, we'll be able to tell when splinting is indicated. We'll be able to discuss why splinting long bone fractures are important for our patients and how it helps them. We'll also be able to discuss the types of splints that are commonly available in EMS, the proper steps to splinting a long bone fracture injury, and then some important reminders regarding splinting within our patients. In addition to be able to discuss these topics, we'll also be able to actually perform the procedure on a mannequin. The materials we'll be using throughout this lesson is the PowerPoint provided by me, a mannequin, and some common rigid splints that are most commonly used in EMS. Following the lesson, the student will be administered a multiple choice quiz of 10 questions, and they'll also be asked to perform the procedure that we've discussed on a mannequin using a rigid splint. So moving on to the PowerPoint, we'll go ahead and get started. We'll be talking about splinting of long bone fractures. And when do we want to splint long bone fractures? As you can see, there's quite a few different ways that a bone can be fractured. So the correct answer to this question is that anytime a fracture is suspected, we are going to attempt to splint it. And sometimes that means that we need to fix the fracture before we splint it, and then sometimes, we just have to splint in place because we can't straighten out our fracture. So why do we splint? Why is this helpful to our patient? First of all, it prevents any further injury from occurring. When a bone breaks, it's sharp, and if you don't splint it and fix it, it can cause further injury via swelling, bleeding. We can cut an artery, a vein, and then obviously more pain for our patient. We also want to stabilize the fracture. That way it's not becoming worse than it already is. This is also going to minimize the pain for our patient, and then it also in many cases can restore circulation, sensation, and motor function, which are our top priorities as well. So what type of splints are out there? There's three major types of splints, and that's what we're going to talk about today. The first major type of splint is a rigid splint, and these come in forms of a SAM splint, pictured here, a cardboard splint, pictured here, and padded splints, pictured here. I actually carry all three of these on my ambulance, and they're both great. They're all great. SAM splints can be molded more to your area that you're trying to splint. Cardboard splints are good because they're cheap and effective. And then lastly, padded splints can give you a good form of rigidness to help with your fracture, but also padded so it's more comfortable for the patient. We also have vacuum splints, which despite their name, we're not sucking air out of our splint, we're actually putting air in. They're also commonly referred to as air splints. So basically this would go around your fracture area, and then we'd blow it up and it would support the fracture. Lastly, we have traction splints, which are most often used for femur fractures, and that can be a whole other lesson in itself. So the steps of splinting according to the NREMT, you want to verbalize your PPE precautions. You also want to apply manual stabilization of the fracture before you start splinting, and then you want to assess your motor sensation and circulation of the injured extremity. Then you want to measure your splint, apply the splint, and then immobilize the fracture above and below the injury site. Secure the entire extremity once you've splinted it, and then you then want to reassess your motor sensation and circulation functions of your extremity. Some reminders are that you want to establish a baseline, you want to realign, reposition, or splint in place. You want to add padding to comfort your patient and create a good environment for your fracture. You want to secure your splint above and below the injury. recheck your circulation cessation and motor function, and then you want to treat your pain within your protocol limits. All right, that's the end of my presentation. I hope you enjoyed it, and it was nice talking to you.